post-operative pain and marijuana, everything you need to know in this video. My name is Dr. Sagar Patel. I'm a Beverly Hills facial plastic surgeon, and in this video I wanted to talk about all things post-operative pain and what you can do and what you need to know about using THC or CBD for controlling your pain. Now let's get started. First of all, we need to talk a little bit about disclaimers. I am not your doctor. I'm not here to give you medical advice. The most important takeaway thing is this video should lead you to talk about what you can do about pain with your surgeon. I would like to have this video to go out to everyone, including other surgeons, because I feel that we don't talk about the options of marijuana or THC and CBD in controlling pain. What we mainly use are opioids, and opioids have gotten a lot of negative publicity lately. I led one of the leading studies on post-operative pain after a nose job, and we found that it's something that's not talked about between patient and surgeon often enough. And the very least, this should be something that's discussed no matter what surgery you're having. Now, we're talking about two different types of pain. I'm not a pain specialist either, but I understand there's chronic pain and acute pain. Acute pain is what happens when you have surgery. Most surgeries come with pain, and it's normal to have pain. What we do to manage it is really important. Now, with most surgeries, using medications like ibuprofen, Advil, Aleve, or any non-steroidal anti-inflammatory or aspirin is not good because they cause bleeding. Now, since we can't do that, we use opioids. Opioids work on receptors in our brain that can alter your sense of awareness and consciousness, but also help reduce pain. As you may have heard of these words like Norcos or Percocets. The actual drug names are going to be anything from hydrocodone or oxycodone. These medications have a lot of positive tools and benefits. However, they also come with certain negative benefits. And for a lot of us out there, whether it's inherent fears or the possibility of addiction or any of the other downsides of opioids, we'd like to do everything we can to control pain. Now, as a surgeon, I tell people it's not just about controlling your pain, it's also about controlling your blood pressure, because having extreme pain, whether you can grimace through it and get through your acute post-operative recovery, can lead to more swelling, bruising, and even complications like bleeding. And so we do want to control your pain. Now, when it comes down to it, if opioids aren't the best option, what else is there? And that's where I think surgeons in general need to be more aware of the tools in our armamentarium, specifically being marijuana. Now, marijuana comes in two forms. There's THC and CBD. When comparing CBD and THC, it's important to remember that CBD does not have any psychoactive effects the same way THC does. So though it's not as potent, you can use it for an appetite stimulant. You can use it topically in certain surgeries, and that's something that you'd certainly want to ask your surgeon about. And more importantly, you can use it orally to help improve your pain. Now, when it comes down to it, the important thing to remember is if you are a user of THC and are going into surgery, even though your post-operative pain might be higher, you have the option of combining THC with your opioids to reduce the amount of opioids you need. And this is important because it's going to help counteract some of those side effects that we don't want for opioids, while also decreasing the amount you need. It's really important to remember that when you're using the THC, you're relying on your previous experience. So remember, things like a blunt wrap has nicotine in it, so avoid that. Talk to your surgeon about what they actually recommend in terms of the type of use. Would it be vaping? Would it be using the product orally? Would it be using a product topically? And most importantly, remember that your dosing is going to be different than usual because you are experiencing actual acute pain. Now, the inherent problem that is the argument against something like THC is going to be that it can cause a state of paranoia or a nervousness that's not ideal in the post-operative period. Specifically for patients who have never taken any THC, I would probably recommend you stay away from it from your first dosage. You don't know how it's going to affect you. You don't know how the feelings are going to change as you go through the experience of having tried a THC-based product. Now, if you're someone who uses it, understand that generally speaking, a study released in 2020 by anesthesiologists showed that people who use THC products require a higher dose of anesthetics, something like sevoflurane, a higher dosage of pain medication afterwards. Now, I don't know necessarily to believe that. and for everyone, but what is true is that you still can use THC and or CBD products. Now, the one thing I would tell you as someone who's a double board certified facial plastic surgeon working from the neck up is almost every surgery is going to be a no when it comes to smoking anything, whether you're vaping or using a product in its raw form and smoking it. It's not recommended during an acute post-operative recovery because smoke can inhibit healing in your respiratory passages, oral passages, or even your neck, even though there's no nicotine in these products. However, you can still use tinctures, oils, and edible products. Edible products can contain CBD and THC. Now, when it comes down to it, opioids are notoriously bad for causing nausea. In fact, in all of my female patients, when I prescribe, and don't ask me why females tend to have it more than males, but whenever I prescribe an opioid, I have to prescribe a medication that reduces nausea because so many people can throw up. And I do a surgery, that is my least favorite thing for a patient to have to experience because it can increase the risk of severe side effects like bleeding, and I don't want them throwing up, and the medication I'm using for pain is gonna increase that. A THC or CBD product will decrease that and actually increase your appetite. In addition, it doesn't cause constipation. It helps improve that, whereas an opioid can cause that problem and make that into a problem bigger than the pain itself. Now, there's so many reasons we can talk about benefits and downsides of this treatment. The most important thing is that you talk to your surgeon about it. And if you're a surgeon, please be aware of the literature. Please be aware of the possibility. And even though it's not federally legal, it's legal in over 30 states now, and we can totally use it to help our patients in the right patients. If you have any questions, reach out to our office to schedule a consultation, and look forward to seeing you guys soon.
Cushman go a great, take a steezy to the face, then hit it till it blank, and try this easy challenge, and try to keep your balance while you take it to the face, cause one hit from this grape got me thinking it's an eighth, thinking it's a wave, thinking it's the weight, thinking it's the play, thinking about everything that I'm about to say.